Hi, it's Dr. Rankin. Thank you so much for tuning in. Welcome back to my channel. I want to apologize for being absent these past couple weeks. We have had a couple things come up, but all is right with the world. We are back on our filming every Tuesday, so thank you for coming back and joining. Today we're going to talk about stress relief and stress management and chiropractic efficacy in dealing with those types of things. In the last 2 weeks, we've had a large number of people who have come in with basic wear and tear, a lot of physical stressors, but we want to back up and talk about how some of our physical stressors actually show up in our body. And many of that is because 70% of an average adult stress, regardless of gender, is in their mental emotional capacity. So basically, with all of the uncertainty that is going on in our community right now, especially with young people going back to school, if they're going to be going back to school, job security, jobs changing, people being laid off, people starting new things. So there's lots of change. And with change, there is definitely stress because change is hard for most human beings. So we want to talk about how chiropractic and why chiropractic works so well in helping manage stress. So in this practice, aside from laughter, which is one of our main ways of helping reduce and manage stress here with our patients, is trying to take things a little bit less seriously and take some of the edge off with all of the anxiety and some of the feelings that are going on, is helping restore balance. So the majority of our patients come in for physical stressors, and as you guys know who've been watching, part of chiropractic treatment is to help restore posture. So a lot of our spines don't look nice and straight and they aren't curved in the right places. Okay, and so when things aren't curved in the right places or when our weight bearing is off, we start to see joints get wear and tear, and it puts a lot of wear and tear and pressure and stress on actual nervous system. And how balanced your nervous system is directly proportional to how your body's going to feel. So one of the major side effects of a first-time treatment for a person who's under the age of 40 is really good quality sleep because their stress has been reduced, their body is balanced and restored. Your body can handle just about everything that we're throwing at it, okay? It just depends how tolerant is it going to be and how healthy are you so that your body can actually manage those stressors well, okay? So the chiropractic treatment is to help reduce the pressure that's within some of the joints, take the pressure off the nerves and help restore things. As we restore things, the stress in the muscles that are supporting poor alignment is temporarily reduced, as well as the electric muscle stimulation therapy, which also fatigues out postural muscles to temporarily reduce stress and get some balancing and some relaxation going, as well as using a heat pack or a cold pack to help reduce inflammation or relax as well. Okay, with that chiropractic treatment, and I want to revert back here to our spinal distribution in our nerve chart, we can look at this guy right up here. Give Mr. Spine a break here, just a titch. You can see that everything is interconnected. So your brain tells every organ, cell, and tissue in your body what to do based upon the synapses from each of the nerves, okay? And a lot of this is physical, but much of it is also chemical as well. So when you are stressed, you have chemical reactions which become physical manifestations, and chiropractic helps reduce and repair some of those pieces so that your body's able to cope better with the stressors that are handling, as well as maintain your immunity and cut down on things like allergies, sleep trouble, digestion issues, and other thought processes that just negatively are impacted when your body is distressed. Another thing that is an indirect result of quality chiropractic care is pain reduction, which allows you to exercise. Now, exercise is more so of a stress management, not a stress prevention tool, because the stress response has technically already happened, okay? But if your body's in pain and you have low back pain and it's radiating down to one of your legs or your hips, which is a very common thing we've seen here in the last few weeks with our physical laborers, especially in summer, you're not going to be able to exercise. You're not going to be able to make it through a workday because your body is in too much pain, and that will itself cause financial stressors and mental emotional stressors as well. So just as our nervous system is interconnected, how our body handles mental, emotional, chemical, and then physical stressors are all connected directly and indirectly as well. So helping make sure your body is well maintained, out of pain, will ensure that you're able to get high quality exercise in as well, and then reduce those chemical effects that are in your blood that have been released just basically. I can hear all of that stuff. Getting back to our stress reduction and our stress relief talk here, those quality exercises will enable you to clear your body of all of the waste. So we call it junk in the blood, epinephrine, norepinephrine, excessive cortisol, which will circulate and then damage your arteries and your heart as well. So chiropractic is more so than just pain relief. It's more so than just stress relief or stress management. It also prevents everything that it treats. And so this is a recurring message that we're going to continue to hit home here, as we are technically now seeing more people turn to chiropractic as insurance coverage for medical has been on the decline for the last couple years. It has hit our community very, very hard. Everything we do here is to make quality care affordable, reasonable, and accessible for everyone who wants it. We are busy, as many of you have seen as you're coming in here. However, there's still room for people who want health and healing. So don't forget to subscribe if you're a brand new member here, or if you haven't seen our channel in the past. Welcome. It's been wonderful chatting with you here today. And give us a call, or any chiropractor in your area, local, or returning to your old chiropractor who you haven't seen in a while, if your body is physically distressed for any reason, whether it be mental, emotional. Remember, those things do alter our posture and put us in that defense form. So those are the types of things that you want to be treating for. Chiropractic is for everybody, young and old, both genders, all different kinds of socioeconomic status, and all kinds of different budgets. So there is no one size fits all, and that will continue to change and evolve here as our situation with our community does as well. So we'll go ahead and sign out. Thank you for tuning in, and we'll see you next week. Bye.